Hello, I'm Dr. James Brown, Orthopaedic Surgeon at St Vincent's Private Hospital in Northside. The ACL, or anterior cruciate ligament, is a major stabilising ligament of the knee. It's usually injured if a person twists their knee while trying to change direction. Commonly, this occurs in sports like football, soccer or netball. An ACL rupture results in immediate pain in the knee, significant swelling and difficulty with walking. Without reconstruction, the knee often becomes unstable and could lead to further damage within the knee. ACL rupture is still quite uncommon, but the incidence is increasing. The most common age of injury for females is 15 to 19 years old, and for males it's between 20 and 24 years. There are a few prevention strategies to guard against ACL rupture. Training is extremely important to ensure adequate musculature and core control. Coaching is useful in changing poor technique that could leave you vulnerable to ACL rupture. And there are a series of specific approved warm-up techniques that have been shown to decrease the risk of ACL rupture. Certainly not everyone needs to have their ACL reconstructed. I recommend it to anyone who can no longer trust their knee to be stable. I also recommend it to anyone who plans to return to a sport where there is a need to twist or change direction. Your doctor will advise a treatment plan tailored to your individual needs. Most surgeons will borrow tendons or part of tendons from around the knee. The tendon material is shaped into a new ligament and connected between the tibia, the shin bone, and the femur, the thigh bone. This is done predominantly with a telescope into the knee joint. Occasionally the meniscus, which is a shock absorber of the knee, also needs repairing. Rehabilitation starts the day after surgery. Physiotherapy treatment is essential for a good outcome from this procedure. The first phase of rehabilitation is swelling control and exercises to increase the movement of the knee. Exercises to increase strength and control follow the first phase. Controlled jogging often begins around the 3-month mark, followed by a gradual return to sport-specific exercises. Most people are able to return to sport between 9 and 12 months. Remember, it is always important to follow the advice of your treating doctor.